Now we're moving on with the next presentation, which is the presentation of Gavi zero dose evaluation from Ipsos. We have a number of panelists in the virtual environment. I think we have Jessica Baxendale, Louisiana Lush, and I think Esther is from our team, from the MEL team. She's the head of our centralized evaluation unit. She's gonna give us some introductory remarks before we start with the Ipsos team. Louisiana, are we also gonna have Jessica joining?
So I was under the impression she was joining. Apologies that she doesn't seem to be here at the moment. I don't know whether she's having problems joining, but I'll nudge her my end and see what's happened.
No need. I mean, if you are the one that was planned
I'm going
to
present.
deliver that's okay. That's enough. I think. Esther, over to you then. Thank you.
Great, thanks, Gus. So I'm going to provide a very brief background and then hand over to Louisiana. But before I do, I wanted to express my appreciation to the great presentations today and really rich discussions that we've heard. So the zero dose evaluation, it kicked off in 2022 and it's planned through 2025. And the intention is to provide design and implementation insights related particularly to strategic goal 2, and with the overall purpose of evaluating the relevance and coherence of the zero dose agenda, assessing the operationalization of the zero dose agenda through Gavi's 5.0 and 5.1 levers, funding levers, exploring the plausible contribution of Gavi 4.0 pro-equity grants and grants that were initiated under the current strategic period to achieving Gavi's targets related to zero dose in these communities, and also to generate lessons learned on the implementation of the zero dose agenda to inform course correction and development of the Gavi 6.0 strategy. So phase 1 provided critical evidence to inform the development of 6.0, particularly in relation to the relevance and the coherence of the zero dose agenda. And we're now in phase 2 of the evaluation, and we have emerging evidence from 5 focused topics that were agreed with the Secretariat and with Gavi's Evaluation Advisory Committee to inform the health system's strategy and the operationalization of 6.0. And these included PHC integration, partnership, the advocacy piece of the IRMA framework, ZIP, and barriers to zero dose implementation. And it's also important to note that this evaluation captured key country voices at the national and subnational level in 7 countries to inform these draft findings. And there's a third phase to this evaluation, and we're currently consulting with colleagues in the Evaluation Advisory Committee on evidence needs to really ensure that what's delivered in phase 3 really addresses these needs and is as most useful to users as it can be. Before I hand over to Louisiana from Ipsos, huge thank you to you for your work through this phase and to our EAC focal points for their engagement through this process. So over to you, Louisiana. And I think you're sharing draft insights on 2 of the focus topics, PHC, integration, and advocacy. Thanks ever so much.
Thank you, Esther. Shall I just go ahead and I'm not quite sure who's moving the slides, but
we will be handling that from our side, Louisiana. Yeah,
okay.
Bruno's here doing that.
Great.
You just have to say next slides, and he can.
Thank you. So just to this is just a structure of the presentation. So very brief comments on the background and methodology, some of which Esther has already said, and then I'll move on to findings from 2 of our focus topics. Next slide. So just to reiterate what Esther said, this is phase 2 of a 3-phase and 3-year evaluation. So we're right in the middle. And the overall evaluation is designed to assess the contribution of Gavi's grants and funding and non-funding levers to its zero dose agenda. For various reasons, that kind of wider objective of the contribution analysis was put on pause for this year. And instead, the Secretariat asked us to work on a sort of deep dive into 5 focus areas that they were particularly interested in the context of developing their next strategy, but also to inform implementation of the current grants. And the areas are there. And today I'm only going to present on focus topic 3, which is on primary healthcare integration, and focus topic 5, which is on how advocacy is influencing the implementation of the zero dose agenda within the IRMA framework. And I know you've been talking about that a bit earlier today. And I just wanted to say, I guess, having listened to the last couple of sessions a little bit on and off, I'm conscious that our work is much more looking at the work of Gavi at the global level and in terms of the funding and non-funding levers that Gavi has, and it's much less programmatic in general and much less close to the front end of the work of the immunization programs that many of you are looking at. And so I just wanted to put that as a bit of a caveat to the work that we're doing. And again, also just to say that we just submitted these findings to the Secretariat a week or two ago. So this is very much emerging findings and has yet to be finalized. Next slide, please. By way of background in terms of methods, this is a mixed methods evaluation. We have activities at the global and country level. We've been doing case studies in 7 countries this year, 5 of which were done in person, and those are Cambodia, Côte d'Ivoire, Ethiopia, India, and Pakistan. And then we did a 6th one by proxy at a stakeholder conference that they held in Oman. That was for Afghanistan. And one that we did remotely at the Secretariat's request, which was South Sudan. And we've been reviewing quantitative data. We don't collect our own quantitative data. We rely on data that is publicly available, both within the Gavi management systems, the CP-MPM and the SAC, and the WUNIC data. We've reviewed a huge number of documents at the country and global levels, and we've conducted about nearly 150 interviews, about 1/3 globally and 2/3 in the 7 countries. And then we've had multiple consultations, etc., with the Secretariat. Next slide, please. So I'm going to leap in now to the first of the topics that I wanted to showcase to you, and this is on primary healthcare integration. So the background here is that obviously, as you all know, integrating Gavi's immunization investments with primary healthcare and health system strengthening is a key agenda both this year, but it has been for a long time at Gavi, but it's been highlighted again at the Future of Global Health Initiatives meetings and the emerging Lusaka agenda. The zero-dose agenda is explicitly and strongly aligned with all of this, including a focus on how to strengthen systems to ensure that they reach the communities and children that are not currently reached, and how to do so sustainably, especially in countries that are soon to transition from Gavi eligibility, of which we have several in our group. There's also been a report by the Gavi Secretariat Health Systems team to the Programme and Policy Committee outlining a series of health system strategy, both achievements, but also a set of problem statements, including inadequate understanding of the purpose, comparative advantage and expected outcomes of Gavi's health system investments, a lack of clarity on how funding and non-funding levers can support health systems and are aligned with other programmes and development partners, and how there's an ill-suited approach currently to the measurement of health system strengthening investment outcomes and impact. And these relate to the similar problems in relation to zero dose. Next slide, please. So the way these focus topics were structured was the Secretariat worked with us to develop a set of evaluation questions for each one. And for primary healthcare integration, they were, to what extent is the Gavi 5 strategy to reach zero-dose children aligned with wider primary healthcare integration and health system strengthening objectives? Secondly, to what extent are Gavi funding and non-funding levers contributing to systems integration? And thirdly, to what extent is the zero-dose strategy embedded into country systems? And for this focus topic, we looked at these questions in all 7 countries. For the advocacy topic I'm going to come on to, there was a limited subset. Next slide, please. So our findings on the first evaluation question, the degree to which the zero-dose strategy is aligned with primary healthcare integration objectives, we found that in theory, Gavi, the current zero-dose strategy very much aligns with primary healthcare integration and health system strengthening. There are explicit statements of the globe in the strategy. There are new ways of working and joint financing initiatives supporting primary healthcare integration, and that as an approach to reaching zero-dose children. And Gavi guidance to countries encourages a focus on zero-dose and equity through primary healthcare integration. We also found at the country level that country approaches to reaching zero-dose children as set out in their full portfolio planning processes, which is the process that governs how the grants for zero-dose should be allocated, and that they align with national health plans and prioritise primary healthcare integration. But what we found was that down the line, in practice, what primary healthcare integration meant was a little bit ambiguous in the context of Gavi's other zero-dose resource allocation strategy. and global stakeholders that mentioned to us that they were worried that misalignment between the zero-dose strategy and primary healthcare integration objectives could potentially reinforce the use of vertical program delivery approaches. Likewise, country stakeholders perceived that Gavi processes beyond the FPP were slightly less well aligned to ensuring zero-dose strategies prioritize an integrated approach. And they felt that on the whole, countries were accountable to Gavi for immunization outcomes, first and foremost, not surprisingly, rather than primary healthcare integration outcomes per se. Next slide, please. On the second question, to what extent are the funding and non-funding levers contributing to systems integration and health system strengthening? The FPP process itself led to varying levels of integration with other stakeholders and programs across the 7 countries. And within the grants, particularly the TCA and the SFA grants, which support Gavi's work with partners at the country level, can leverage and catalyse a more integrated approach to the delivery of zero-dose interventions. And this was supported by some parallel work that was going on by McKinsey looking at all these grants, and they found similar findings. At the service delivery and health facility levels, immunisation services by definition are usually somewhat integrated, and countries identified a number of examples of further opportunities to use zero-dose activities as an entry point for other primary healthcare services, many of which you've been discussing already today. But they also identified missed opportunities, for example, around joint mobilisation of community health workers and combining outreach activities amongst different programmes. At the health systems level, by contrast with service delivery level, integration was a bit more inconsistent across countries, except for countries where there was a pooled fund that Gavi was contributing to through, for example, its HSS grants. And without a formalised framework, accountability mechanism, or donor requirement that mandates health programmes to be delivered in an integrated way, implementation of integrated approaches can be ad hoc. Stakeholders on the whole at the country level perceived primary healthcare integration to be beneficial, but felt that its prioritisation within their zero-dose strategy and associated Gavi guidance could be further differentiated according to the Gavi country segment. So, for example, transitioning countries or core countries or fragile and emergency affected countries. So that was a third request from country level. So to what extent is the zero-dose strategy embedded into existing country systems? Gavi's comparative advantage was felt strongly to be its ability to create political commitment to put primary healthcare at the heart of its immunisation agenda. But in most places, the reality is that the size of the health system strengthening grant resources are independently insufficient really to influence this strongly, and they do need to work with other partners. Gavi, and there were examples of this, where Gavi contributions to pooled funds, for example, in our countries, in Ethiopia, South Sudan, and Pakistan, this enabled them to consolidate resources, streamline funding processes, and enable greater systems integration. In other cases, such as Afghanistan, where Gavi provides critical support for the delivery of health systems more generally, it also directly enables the integration of primary healthcare services. And in countries approaching transition, particularly accelerated transition, they prioritised comprehensive primary healthcare in their approach to reaching zero dose in anticipation of the changing health financing landscape for immunisation. Next slide, please. So in conclusion, the definition of primary healthcare integration and how it relates to health system strengthening or delivers zero dose outcomes remains ambiguous, which makes it difficult for countries to prioritise and enact. Gavi grant levers investments targeting zero-dose children are neither sufficient nor strategically designed to deliver integrated primary healthcare as they stand currently. And Gavi emphasis on primary healthcare integration doesn't differentiate or adapt sufficiently to specific contexts, whether that's at the national level through country segments or significant subnational variation in resources and capacity. And I should say that I'm presenting very much highlight findings from what is quite an in-depth policy brief. So I'm sorry if it feels like a bit of a gallop and it lacks depth. Next slide, please. So the second topic I wanted to showcase to you is on advocacy. So advocacy is obviously step 4 in the IRMA Identify, Reach, Monitor, Measure and Advocate framework developed by the Alliance to help countries reach zero-dose children. And according to those funding guidelines, advocacy serves 2 key purposes. First, to create and sustain political commitment to the zero-dose agenda at global and national levels. And second, to reduce barriers to take up of vaccination services amongst zero-dose communities. And it's also a key component of Gavi efforts to ensure the sustainability of Gavi-funded interventions as countries transition. At the Secretariat, the advocacy at the global level is handled by the Public Policy and Engagement Team, PPE. But other than that, most of the advocacy is done through the country programs and is quite decentralized in the way the Secretariat approaches it. Next slide, please. So we had 4 evaluation questions for this policy brief. What advocacy activities are being proposed through the full portfolio planning process? What advocacy interventions do grants end up funding to support the zero-dose agenda? Who are the target audiences for advocacy and what are the desired outcomes? And how are they planned to be monitored and evaluated? And we looked at these questions in Cambodia, Côte d'Ivoire and India, all of which are countries that are at various stages of transition from Gavi or have unusual Gavi eligibility in the case of India. So on evaluation question 1, what are proposed and planned through the full portfolio planning? This is really about the kind of guidance that's provided and what happens in the planning process at the national level. So Gavi provided relatively limited guidance on how to conduct advocacy to support the zero-dose agenda. And awareness of guidance provided, any that was provided, was pretty low across all stakeholder categories at the country level. In Cambodia, which is in a preparatory transition phase, proposed advocacy activities targeted provincial government, EPI and health departments. In Côte d'Ivoire, which is an accelerated transition, they'd allocated about $6.4 million through HSS and EAF funds to a range of advocacy activities. And in India, planned activities included promoting Gavi-funded initiatives to be scaled up by the government, generation of evidence to support the zero-dose agenda, improved micro-planning to identify zero-dose communities, and a range of demand generation activities. I should say that for this focus topic, we found it really quite difficult to recruit. We had our sort of 7 was our baseline of countries, and it was quite difficult to get countries to participate in this topic because most of them had very little that they would have felt comfortable reporting on. So this was the 3 that we managed to persuade to engage in this topic. Next slide, please. What advocacy activities are grants actually funding? So the FPP process led to, I'm sorry, this is an old version of this slide. I'm going to talk to, I tried to send through a more updated version and I'm sorry that hasn't come through. But what I suggest is actually we just skip, I will talk to this
Sorry,
slide.
Luciana, Bruno,
worry,
are you
it's
working
fine.
with the latest?
I'm really sorry, it's my fault. I sent through
No, you said I
version.
put in the folder. There was a problem in the Can you is it possible to get the other one? Yeah, we're gonna get the other one for you, Luciana. Sorry,
Okay.
just 1 second. So while we wait, no, or it's the same. Okay, so this is the same.
Okay, don't worry. I'm sorry. I'll just talk to it.
There was a problem here. Yeah.
Yeah, it's just the text underneath that is the wrong text. I'll talk to it. So Gavi's, what we found in general was that the definition of advocacy was not consistently deployed at national, at subnational levels in grants. Advocacy at the national level focused on securing domestic resources for immunization, but it wasn't clear that these efforts focused on services for zero-dose communities. So there was a complication around making sure that advocacy not only advocated for immunization, but specifically for zero-dose. And that barriers for implementing advocacy interventions included advocacy being seen as a sort of added value activity rather than part of core business. CSOs, although tasked with delivering advocacy, sometimes lack the capacity to design and implement these interventions. And that in general, we're very early in the stage. A lot of these grants are very early in implementation, and any advocacy activity naturally has quite a long time scale. So there's a sort of insufficient evidence base. Next slide, please. So who were the target audiences for advocacy and what are the desired outcomes? Stakeholders in general targeted at the national level, not surprisingly, were ministries of health, ministries of finance, parliamentarians, donors, and the private sector. Given that the implementation of health policies, including the allocation of budgets, was often decentralized, so a lot of the countries in our group are have federal administrative setups. And so advocating at the subnational, particularly provincial or state level, was key to ensuring a sustained focus on zero-dose communities, and this was less likely to be found amongst the grants. And at the local community, audiences for advocacy included community and religious leaders, parents, community workers, and other community organizations. And our final question was on how advocacy activities were planned to be monitored and evaluated. At the global level, those global activities I referred to at the beginning, undertaken by the PPE team, were monitoring their activities. But at the national and subnational levels, we were not able to identify any consistent approach to monitoring advocacy interventions. So that next slide, please. So in conclusion, different parts of the Gavi Secretariat fund and support global and country zero-dose advocacy, and this makes it very difficult to identify advocacy interventions or share best practice and learn from each other. Gavi stakeholders and partners at the country level don't share a common definition of advocacy purpose or audience, or that is specific to the zero-dose agenda. And that despite providing a clear definition of advocacy, Gavi provides limited guidance on the specifics of design, implementation, and monitoring of advocacy strategies to promote zero-dose, particularly at the subnational level. Thank you very much. That's the end of the presentation, and I look forward to the discussion.
Thanks a lot, Louisiana. This is very insightful, I think, for Gavi and how we organize our levers to be better able to deliver impact in the zero-dose agenda. We have one question so far in the Q&A box, and I think I will start with that one while people is still digesting what they have read, and I'm sure other questions will come soon. I think the question is related to PHC integration, and I think it's actually a clarification between because at some point in your presentation you said that largely countries are already integrating PHC at the last or the first mile, as we're calling it here, but we also, it seems like in some point in your talking points you said that largely countries' main service delivery packages or PHC package do not contain immunization. Can you clarify that? Is that kind of what do you mean by that, and how do those two kind of relate to each other?
Okay, so I'm sorry if that came across. I completely agree that a primary healthcare package at a service delivery level is almost always by definition integrated, and will include immunization, although often it may be delivered through immunization special days or outreach services, etc., at the primary healthcare level. But on the whole, it's more integrated at that level. And I totally agree. Any primary healthcare package must include immunization. I can't imagine one that wouldn't. But I think what we were talking about where they're less integrated is at the national or planning or provincial levels, where often the EPI program remains really quite separate. It has separate budgets, separate staff, and integrating the way it operates and the way it plans to reach zero-dose outreach children is not always the case. And I think there is a tension now emerging between how to work in an integrated way, for example, where primary healthcare doesn't reach whole populations of children, and trying to work out how to do that so that you don't do it in a vertical campaigny way, but in fact do go with a whole package of primary healthcare, I think is the challenge that's facing some countries at the moment.
Thanks a lot for the clarification, Louisiana. I have a question about the point that you said on insufficient of Gavi funds to really kind of catalyze this PHC integration agenda. Would you have kind of a clear recommendations on how Gavi could work with that, and would that be kind of an objective of Gavi to completely integrate, or or have a kind of a more, I don't know, like a diagonal approach? Some components may be integrated, some not. On the strategies that I noted that you have talked about, you talked about the pooled funds, the delivery strategies with some of our partners. But do you have anything else in your mind, or do you have any suggestions on how to operationalize that agenda?
I mean, you know, decades of work have been going into, haven't they, how to integrate vertical and horizontal programs. I do think that Gavi's real opportunities are in leveraging its influence through the pooled funds where they exist. And there were 1 or 2 countries that had pooled funds that Gavi wasn't putting money into, which I was a bit surprised about because they seem to be quite comfortable with doing that in some countries. But then you reach the problem of, well, how do you get the entire pooled fund? How do you know that they're going to go out and reach zero dose communities, which are not necessarily only zero dose for immunization? They will also not be reaching other elements of primary healthcare. But I think my own personal, I do think that exploring those approaches of how Gavi can work more closely with other development partners, with the government primary health program, to make sure that the overall system reaches more communities is the way to go forward. And taking into account Gavi's relatively small HSS and other cash grants, many of which are actually just going to pay salaries.
Thank you. I don't know if there is any other question in the room. I think people's energy is starting to get a little bit down. We're getting close to the end of the day. I think Sunita has a question. Yes, Sunita, please.
It's less of a question directed, at just one aspect, but more of, how can we think through this? What is coming to mind is when we look at the United Nations high-level meeting, generally what gets there are the non-health topics, but the health topics have also made their way there. So it was HIV/AIDS, it was tuberculosis, and now AMR is gaining momentum for the second time this year. So if we look at the common thread between HIV/AIDS, TB, AMR, and we look at the infectious diseases, vaccine preventable diseases, all that coming into the forefront, is there a way that organizations such as Gavi can leverage and look at how do we get the global leaders to commit to these aspects and not just leave it to the healthcare systems to find the way forward, especially because universal health coverage is so central for everything. PHC is so central for universal health coverage. So all of our dots are sitting right there. So how do we use our influential powers to bring immunization domain into the United Nations high-level meeting? So it's like I said, it's not just directed at you, and we are just looking at how do we start thinking towards those processes or
Yes.
piggybacking on existing processes. Thank you.
You want to react to that, Louisiana? Or?
Well, I feel it's a bit out of scope for this evaluation, but on the other hand, I have been involved in those processes in past lives. I used to work for the UK government, and it's really difficult, mobilizing that kind of political heavyweight interest is complicated, and it's a difficult thing to do. But I think that one of the opportunities has been through this Future of Global Health Initiatives agenda, which did garner quite a lot of political attention. And I think Gavi gets a lot of attention. I think people are quite teed on to immunization. It's something that nobody could possibly, well, most people aren't really against it. There are always opportunities to leverage. Whether that will end up with a UN high-level meeting and what difference that makes anyway in the longer run, I don't really know. But yeah, interesting question.
Thank you. There is another question here in the Q&A that came across about the advocacy efforts and the fact that countries may be resistant to share their advocacy efforts.
Yes.
Do you think this is why do you think is that actually? Like, is that a question of not wanting to draw attention to lack of progress, of poorly defined strategies? I think it's a little bit harsh, but it may be the case. Or concerned about jeopardizing progress by discussing it externally, or any other reason. Like, I think there are 2 suggestions here from this question, but do you have any kind of perspectives on why?
Well, I was surprised, I have to say, myself, because considering advocacy was part of IRMA, I think what we were hoping was we were going to go out and find a bunch of grant-funded interventions that we could go and look at. And actually, the country programs were pretty resistant to us doing that. I think mostly because it has been very difficult to design those interventions. and that people who are used to managing immunization programs, perhaps rather related to the previous question, are not necessarily very comfortable as advocates. I do think that's a real issue that could be addressed, and we have some quite strong recommendations in relation to that for the next strategy period. But I think that it's something that is clearly a part of the framework that everybody wanted and felt was the right thing to do. But for one reason or another, that has proved difficult to do, partly because of the constellation of partners that have been engaged at the country level. It's one of the things that's been going on is that there's these expanded partners, so all these new CSOs that are coming on board. But as yet, that's all very, very early days. So there's been a very slow process of contracting these new partners in most countries, some of whom will have more experience with advocacy and will be interesting partners for that. But it's taking quite a while to get going. And I think that combination of not being quite confident about what they should do and not being quite confident about who was going to do it has meant that it's been quite slow to start up. But I think everybody seems to agree it's the right thing to be doing. It's just the how rather than the what.
And we made very good discussions on advocacy as well here in previous sessions. And we will share all these materials with you as well, Luciana, if you want to take a look on that later.
Yeah, be really interesting.
I think we don't have any other questions in the chat, and I think it's quite late. So I think we can close the final presentation now. Thank you very much, Luciana.